I think if you have these things in place, you open up your mind to have space to come up with innovation. And the physicians are the boots on the ground, right? We are the ones talking to the patients every day. But unfortunately, we're not really involved in the innovation, right? It's either legislatures or administrators, MBAs that are driving potential innovation. So if the physicians learn how to optimize and systemize, and they can kind of talk at that level of the business side of things, they can really meld the patient part, the business part, the healthcare system part, much better, in my opinion, than the other, the people in Washington that are trying to do it right now.
Welcome to the Care We Need podcast. We bring together patients and providers to explore how we can improve U.S. health, wellness, and human services systems to better serve the growing population living with complex illnesses. This podcast is brought to you by Bennis Companies, where we provide education, consulting, technology, and other resources to help health and wellness professionals deliver better health outcomes for their clients. With us today is Dr. Rishan Shah, a board-certified cardiologist and practice owner focused on preventative, patient-centered cardiovascular care. Beyond clinical medicine, he is deeply engaged in entrepreneurial efforts that help health professionals optimize their practice and reduce administrative burden, supporting better clinician health and better outcomes for the people they serve. Dr. Shah has a really amazing perspective on optimizing your systems to improve your life. If you find value in today's podcast, don't forget to like, subscribe, and share this with someone who would benefit from it. Let's go. Dr. Shah, why don't you tell us a little bit about who you are and what you do across all of your different disciplines?
Sure. I'm an interventional cardiologist. So I went to medical school and did additional training to become a cardiovascular specialist, and then another year to do what's called interventions, minimally invasive procedures and surgeries, basically. I've been in practice for more than a decade. And for the last 8 years, we've been in our own practice, trying to take care of patients, help prevent chronic illnesses, specifically heart attacks, heart failure. Prevention is a big interest of mine. And then also during the process of running my practice, also helping other practice owners, healthcare owners optimize their business processes so they can go back to having a life and focus on their health as well.
Heart disease is, as I understand it, the number one killer of Americans for the last 100 years. Is that accurate?
Number one killer for a long, long time, yes.
Wow. And so what got you into that field? Is it you saw an opening and decided to fill it, or is there a personal story behind what pushed you towards this field?
Becoming a doctor in general is really, I grew up in a small town in Missouri for the first handful of years. And there was the family doctor that you would go to. He would see kids, he'd see adults, he'd kind of do everything, right? Regular rural medicine type of doctor that you thought about. Cardiology specifically happened when I was in my residency training. And I did a cardio rotation, and you could take care of really sick people, and they're in the acute setting, make them well. There's lots of technology, diagnostics that could really help people, but also you could prevent these issues in the first place. So the combination of prevention, plus if needed, taking care of these patients in their, biggest time of need is what really drew me. It's a combination of lifestyle changes, medication, procedures, developing connections with people, right? Relationships over many years. Those are kind of things that really pulled me to that specialty.
We'll get back to that conversation in just a minute. Right now, I want to let you know about 2 powerful keynote speeches that Tanai Bennis is offering. One to help care organizations improve their systems, and one to help empower the people navigating complex illnesses within them. Her first talk, Win the War on Complex Illness, comes straight from the battlefield. As an intelligence officer in the United States Army, Tanai took the worst performing brigade in her area of operations and helped turn it to the best, using a framework she calls the 4 steps to winning a war. Now she brings that framework to health, wellness, and human services organizations so they can improve complex illness outcomes without rebuilding from scratch. Her second talk, Heal or Die, is deeply personal. Tanai spent years battling complex PTSD, chronic fatigue, depression, anxiety, and suicidal ideation. Today, she's thriving as a wife, mother, author, and entrepreneur. In this keynote, she shares the mindset and lessons that helped her take back her power, reclaim her life, and achieve real results despite disintegrated health, wellness, and human services systems in the United States. Visit tanaibennis.com/speaker to learn more or to book Tanai for your next event. All right, back to it. And you mentioned a little bit about what you do beyond cardiology itself. what started you down the path of kind of branching out and working with other providers and working with other integrating other disciplines, that sort of thing?
So one huge problem in all professions is burnout, right? So like many physicians are burnt out. There's more and more demands on us put on, the phrase, dying by a thousand cuts comes to mind. We're asked to do more admin work, administrative work. We're not really practicing at the top of our license. One example is, a CEO of any other business is not going to be taking their own meeting minutes, right? But we take our meeting minutes, meaning our patient visits, right? We're documenting
Yeah.
everything. We're the secretary most of the time for that. That's just one example, but just running a business as well as trying to take care of patients is very difficult. So at one point, I was working literally every single weekend, going to 5, 6 hospitals. Must have been 70, 80 hours a week with small kids and a wife that's not happy that you're away every weekend. And I said, there must be a better way. So the business part of things really started putting some thoughts going through my head. How can we improve, and starting to read some business books? And so I learned that delegation and automation and systemizing things not only helps with your personal health and wellness, but also in the business. So I've started helping people with staffing needs, specifically placing offshore staffing into medical practices. Every year, the costs go up for all business owners. And so we are able to get lower costs and very good employees offshore. I also have an automation platform, and we've recently just launched a platform to help doctors give nutrition and exercise counseling to their patients, all covered through Insure. My goals are, help the physicians, help patients, win-wins all over, all around.
So what part of that are you able to automate? Is it like recording videos, or is it just setting up an AI bot to be able to answer basic questions? What does that look like?
So one part is, yeah, we're developing a voice AI, which is very popular these days. Second part is making clinic visits very efficient in terms of patient intake. So one part that the doctors do is take history. So we want to learn more about you. But part of that is, can that be automated so I can spend more time talking to you, looking at you face to face, not staring at a computer typing, and really spend my time making decisions and getting to know you. And so trying to automate that whole history process where I can look at all the information before I go in and talk to the patient is really
Hmm.
helpful. And so, I'm not staring at a computer most of the time when I'm, I don't know if your own doctor, they stare at their computer typing away, just to get the notes done.
Yeah.
That really helps me also connect as well.
Yeah. It's honestly such a obvious gap in my mind looking from the outside in. When presumably you went to school for a decade or around there, and then you spend a good portion of at least the first part of your visit with a client just writing down history. And it's like anyone could do this. Like you said, AI could do this, but you are sitting there having to spend your time doing that and filling in the notes and doing all that stuff. And I can understand the need to have kind of some hands-on understanding the history and all that so that you know what you're getting into. But it does seem like there could be a much more efficient way of doing that so that you're able to spend your time doing what you do best, treating patients and doing so in a more humane way.
Yeah, so AI is one option. We have nurses in the Philippines, right? So they are educated that can scribe for you. One of the big things is, the few times I've been a patient, it's always hard to get a hold of the doctor's office on the phones. And I think a
Hmm.
lot of service business, I read one statistic that 30%, doesn't matter if you're a plumber or doctor's office, 30% of phone calls go unanswered. They go to voice. So especially in medicine, that patient needs something, right? They're in pain or they're worried about their health. And so we've been able to use offshore staffing to really make sure that our phone calls are never missed. We don't have phone calls get missed. And the next evolution of that will be voice AI as well. Although I'm a little nervous about doing that in medical practice, just because someone's calling you because they're hurting, right? They're concerned about something. So to speak to an AI agent, I'm not totally bought in for all use cases, but there are definitely use cases where that can help as well.
Yeah, definitely. Kind of on the screening and intake side, perhaps a lot more AI could be used, but for the more in-person diagnostic stuff, I could see that requiring a much more personal touch and working with someone. I can definitely also see you work with a lot of chronic illness patients and or clients, and that's something that we've seen in our own company's research. One person, for example, had to visit 17 different providers before they got any kind of workable solution to move forward on. And you imagine going through that process with every single provider that you work with. And an hour of time and I don't know how much money every single time you meet with someone. So if you were able to do that ahead of time and even just add the screening portion of, are we a good fit? Are we not? Or who should you probably check out if it's not me? That would save so much time, not only on your side, dealing with people who at the end of the day, you kind of figure out probably not the right fit. And you should probably go talk to this person, but also on the client side, instead of having to talk to 17 different people, it's like, oh, these are probably the right people I should go talk to. So setting up that system ahead of time could do so much good.
Yeah, and it is very difficult from a patient standpoint navigating the US medical system because we are so siloed, right? You might go to your primary care practice and primary care physician, they try to do as much as they can because they take care of the whole body, but then they decide which specialist to take, to send you. So if they come to my practice and, I don't really see anything cardiac, well, I'm going to tell you, I don't think it's the heart. I know you're still having, for example, shortness of breath. I think maybe lungs. Go see the lung doctor.
Hmm.
The lung doctor might see
Hmm.
something different, right? So like you're getting sent to
Yeah.
specialists, but like
And
there's
in
so
the digital age,
right.
that those visits could be at least virtual or at least automated or something like, and rather than one person pinging around from office to office.
Yeah, I mean, but like, from a patient standpoint, and I obviously understand why it's difficult, but there's so much knowledge in medicine. There's no way for one person, right, one specialist to
Hmm.
really 3, 4 specialties to the depth.
Yeah.
This is why you have a primary care doctor that, wide breadth,
Hmm.
not as much depth. I
Yeah.
have narrow, breadth, but lots of depth. Um,
Hmm.
telemedicine, especially since, pandemic insurance is covering. So, we've definitely used that a lot. Lots of practices use that. My
Awesome.
wife is a physician. She does weight loss and nutrition. And so the whole practice is telemedicine. And it's been a game changer, right? Patients don't have to drive. They can do it from anywhere. People are working more these days. So, I mean, just accessibility really helps.
And what does that do for licensing and state licensing and stuff if you are able to meet with a broader geographic area of people because of the telehealth? What does that do for licensure and stuff? Are you able to work with someone in a different state, or is that not how that works yet? Has that not been
Right.
adapted
Yeah. No,
so
you still
far?
have to be licensed in each state. And so just because I'm in Texas, so just because I'm licensed in the state of Texas doesn't mean I can see a patient in Missouri. The
Hmm.
licensure process has gotten easier. You'll have to pay for each state and redo the licensing for each state. Each state might have different criteria. So hopefully one day they'll have just one US license, but right now it is still statewide. So technically I cannot see a patient if they're traveling to, Hawaii for vacation. Technically
Yeah.
they need in the state of Texas.
Yeah. I can see the need for that, just to, like you were mentioning early, delegating responsibility from the state to be able to manage and make sure the licensees are well vetted and well trained and all of that. But it's certainly, I think there's going to be a change needed in as things develop in the next 50 years or so, the internet age, all of that, a different shape of the way the healthcare system works. And hopefully some of those obstacles will be shifted. So what type of talking about kind of screening patients and talking about who is the right fit for you, what clues you in when you are talking with a person, or either in your office, or say you've gotten involved in a conversation with someone in a coffee shop? Like, what tells you that this person is the right fit for you versus they should probably go check someone in a different discipline?
I mean, as we mentioned at the start of the show, heart disease is the number one killer. So chances are you are the right person to see a cardiologist. And you make
Statistically speaking.
statistic. And since half my practice is prevention, I get at
Mm,
least a patient every week whose friend and their died in their sleep.
mm,
They're concerned. So there's tons of people that can improve their health. Even if you think you're the healthiest person, there's probably some aspect that you can improve if you want to, whether it be just lifestyle changes, whether your blood pressure is high and it's been high forever and lifestyle changes haven't worked, and maybe you need to talk about medicine, right? Everything has a place and a role. So
mhm.
really, almost anyone we can help.
Okay. So then what tells you that this person is not the right fit, or at least right now? You mentioned that almost everyone can be helped statistically by you in some way right now, but sometimes there's a coordination of when to do what first. So what might tell you that someone should start with a different discipline first and then come to you?
I mean, one of the big parts of what I do is where they are in their own health journey, right? Are they ready? I'm not going to tell them to do 25 things if they're not ready to even do one. So many times, I might just say, hey, just, nowadays with iPhones, you know how much people walk. It tracks you even if you don't know about it. So 9 out of 10 times, I'm the first person that opens up their iPhone and clicks on the health app and say, hey, let's see how many steps you're doing a day. You're doing 500 steps a day, which is nothing. Can we just get that up to 1,000? Just like those simple measures to start with to get them to buy in. um, and then to develop a trust and relationship with me. I'm not asking, and I'm also trying to meet patients where they're at. For example, like I might really think medicine is appropriate for someone because the science and the data and the evidence really prove that over 30, 40, 50 years that it's going to help prevent heart attacks or whatever we're trying to treat. The patient's just, concerned, and, got to really meet them where they are. And then once you develop that relationship, then they're much more likely to trust you, right? Your opinion. And unfortunately, in 2025, there's a lot of distrust of the medical system, you know, because of whatever's out there. So that's the step one. So if I can develop that relationship and just make small steps, we can help them out even more.
And in your prevention methods, do you focus on lifestyle changes, or do you focus on, you mentioned a minute ago, medication? Like what is the approach that you take, and kind of what's the progression of, let's try this first and then move to this and then this?
It's right person, right place, right time, right reason. So I'm not dogmatic in any way. Lifestyle changes should always play a role, right? We can always improve lifestyle. Like there's probably nothing more than, nothing that can improve your health more than exercising and eat well, right? So all lifestyle changes really go back to that. But also getting good sleep, trying to reduce stress, obviously stopping smoking, don't drink too much, all those sorts of things we can focus on. But if a patient already has evidence of disease, heart blockages, well, we know that certain medicines will prevent you from having more heart attacks. So not being dogmatic and just telling patients that there is science behind this medicine, but like we still want to 100% do the lifestyle. It's like, do you want to do a little or do you want to do everything? Do you want to reduce your risk of having issues all the way down or just a little bit? So it's really, again, meeting patients where they're at.
So depending on where that person is and what they're willing to do, it sounds like you might recommend a lot of lifestyle changes, a little medication, or a little bit of lifestyle changes, and then later perhaps surgery. I don't know. Depending
Surgery
on
is
how things
definitely the
progress.
last
Yeah.
resort, right? Yeah, that's definitely the
Yeah.
last resort. We want to try to do everything as non-invasive as possible, but for the right person, it can potentially save a life. It just depends. But no one patient's the same, right? So it just kind of depends on what else is going on with them, the rest of their medical problems, their family history, age. It all kind of plays a role. Diagnostic testing, blood work, all that gives me clues to what's going on inside your body.
So in your preventative care and in your chronic illness care, you kind of have to deal with a systems approach, because there's so much going on that is involved in someone's health, even if you just focused on cardiology. But I know that you bring in a lot more than that. What type of practitioners, what type of professionals, what type of disciplines do you find yourself partnering with in order to address the whole person? Or what type of people, what type of professionals do you end up sending people to a lot in order to address those kind of neighboring areas of care?
By far, it's dietitian, personal trainers, health coaches to really, I have 15, 20 minutes with the patient. It's hard to talk about all the things that's needed to improve diet, improve exercise in that time frame. So we've actually included dietitians and personal trainers and health coaches in our own practice now. And what many people don't realize, it's completely free through insurance or most insurance providers, right? So you can have unlimited dietitian appointments and personal trainer counseling appointments. And we make it easy. We do it, virtually. I started a company called Pillar Health Solutions. Where we're offering this same service to other doctors to provide to their patients. Because I think, the lifestyle stuff is what's going to, and that's what the science says, prevent chronic illnesses the most. Of course, the primary care doctor is kind of the starting point of all this as well, right? That's who you're going to go see first. But there's so many resources out there in terms of learning about how to manage lifestyle and longevity. Can we live longer? It's not just about living longer, but living that length of time very well. There's something called lifespan and health span, right? So lifespan is actually the chronological number of years you're going to live, but health span is how well are you going to live during those times. So that's my goal. So I tell people, I'm glad when I see a 30-year-old. I'm I don't have any 30-year-olds. I'm really glad when I see 30-year-old, because what we do now is what's going to affect you in 20, 30, 40 years. weight, metabolic syndrome, obesity play huge roles in all diseases, not just cardiovascular. Obesity is one of the biggest leading causes of cancer, rheumatologic diseases, like obviously endocrine disease, like diabetes. So if we can help with those lifestyle changes on the front end, hopefully can prevent those on the back end.
Sort of a longevity versus vitality sort of thing.
Exactly. My goal is not just to make people live longer, right? Like, what's the point of living till 90 if you're stuck in a wheelchair, you can't go anywhere, right? Don't have any quality of life. So it's balancing quality and quantity.
So, question, there's kind of a perception of kind of certain types of doctors avoiding certain other types of doctors. And I want to kind of drill into that a little bit. Is for the people that you partner with, do you bring in people from any other philosophies of medicine, Eastern, Western, integrative? Do you partner with those, or do you tend to focus a little bit more in Western, kind of conventional methods?
I mean, for cardiology, yeah, it's probably mostly Western. There are definitely like acupuncture, right? There's science behind it helping with pain, right? So if I don't say no to anything. If there's some science that says that it might be beneficial, I'm all about that, especially if there's no harm. So technically supplements, for example, most of them, the vast majority have them have really no good evidence that they do much. Other side, they don't really have harm. So I tell patients, if you want to try it, go for it. As long as it doesn't cause any harm. So yeah, I'm open minded. But like in cardiology, there really isn't, as far as I know, other specialties like non-traditional medicine specialties to help.
So let's go a little bit more towards what you were talking about with how you were helping other providers improve their practices through automation and through hiring outside the United States, for example. What type of results have you seen? What type of improvements have you seen in the lifestyle or the quality of life, quality of practice of the professionals and perhaps of the patients? What kind of results have you seen from that?
So I started using these in my own practice many years ago, and I saw how much it helped me have my life back. It's a delegate. We talked about it. We want to try to practice at the top of our degree or the top of our license. So as much as we can delegate out to other people is what's important. Um, and one thing,
I like the way you put that. We want to practice at the top of our license. Like that makes a lot of sense. I never heard it put that way. We are allowed to practice. We are trained to practice at a certain level. And really, if we're practicing down here, it's not wasting our time, but there are other people that could be doing this, and there are people that I could be helping. That
exactly. And
makes
then if they're
sense.
also stressed about how we're gonna, make ends meet in the business side of things, right? We're trying to balance both sides. We're trying to balance taking care of patients and also trying to run a business as well. So you want my mind to be 100% on your health, right? Not worried about is that front office person answering that phone call that the patient needs to, get in and schedule their appointment. Um,
You also need to be operating at your own optimum. Like if you're burnt out and tired and all that stuff, your brain isn't going to be working clearly. You're not going to pick up on symptoms. You're not going to be able to make accurate diagnoses or anything like that if you're not at an optimum. So you're boosting your own system to be able to work at a better level to be able to help your clients. If you're at a better level, your clients will be at a better level.
Right, and having been stressed out and burnt out, yeah, I mean, I knew how it felt. We started hiring offshore talent. The primarily reasons are, one, there's a lot of turnover in US staff. Two, with inflation, wages are going up, and what people don't realize is I don't control how much I get paid. Right, the practices never control it. The insurance companies control it. So even though patients get upset at us about billing issues, we just follow insurance's rules. But we're
I
the
just
face.
work here.
Yeah. Or the face-to-face people that they see, right? I always tell people
Yeah.
my office person or that's, at the front desk has the hardest job, right? Any
Mm.
issue that comes up, billing or whatnot, always they get the brunt of it. But we hire people that can answer all the billing questions, answer all the phone calls, do all the prior authorizations, all the administrative work that's involved around insurance. So we get patients their care, but also the doctor doesn't have to worry whether or not they're going to get their care. And we can keep expenses reasonable. So it makes sense to still be in private practice. How we help practices too is you got to learn how to delegate. It's not an easy skill set. One of the big things is developing standard operating procedures. That is one of the biggest things that's given my sanity. We tend to have office managers that are, kind of the leaders of the business. And if you have an office manager that leaves, you're screwed, right? All the knowledge has been in their head. It hasn't been written down. Systemizing those things has also been able to give life back. So you're not worried, oh, well, this person left. Is this getting done? Is that getting done? So not only do we staff people, and I'll just plug, it's called Goaling Health, but we also help them use the staffing because we were doctors. We know how to do medicine. We are not trained on business processes. We're awful business people. We're not good managers of employees, frankly speaking. That's all a learned skill set. So we try to help them accelerate that learning as much as we can. But if you can get all that, put together, you get good people. Your life's going to be better. There's a great book I read. It's been a few years now, but it's called Who Not How. It's a I forget the author, but it's a business book. But the concept is not how do we get things done, but who can you have on your team that's going to get it done? That's the way more important part of it. And so we're trying to solve that problem.
I have a note on my board behind the camera here of that I should be focused on the 10% that only I can do. And everything else, as much as possible, I need to hire out.
Exactly.
And what you said about the SOPs, that is the same thing in business as it is in medicine, where if you can develop the standards, then you don't have to be actively thinking about it, actively training people, actively doing all this stuff. You can focus on what you're meant to be doing. So I want to perhaps gently push back a little bit and just understand how you're approaching something. There's a concern for a lot of people that I've seen with a lot more of the administration, a lot more of the customer support being put overseas and how that affects the client's relationship. How does that work for you? How do your SOPs or how does your hiring kind of manage that to where we're not degrading the client experience while we're still making sure that you're able to operate at an optimum level?
Yeah, number one is getting through. So I think that's one of the biggest concerns, getting through to the practice, through the phones, through email, through text, whatever the communication platform is. Lots of complaints from patients and other practices, that we've worked with where they can't get through. So I think that's number one, that it helps. At least you can you can hire enough people to get through. But two, we focus a ton on communication. Everything comes back to communication. It's not that, employees don't care. It's not that they don't want to do a good job. It's not that they don't want to take care of the patients. A lot of times it's just how we're communicating that knowledge and closing the loop. Hey, you have this concern. We will get back to you by the end of the day, and then actually getting back to them by the end of the day or within 24 hours, whatever we say. So we're very clear in our our SOPs with our own internal staff, and we try to really highlight that with our clients. We need to follow these processes, communicate clearly, have clear next steps. Don't be ambiguous. If you don't know, say, I don't know, but I will find out and I'll call you by the end of the day or call you by the end of the day tomorrow, whatever it is. So if we can really clear up that communication, it makes things a lot easier. I think that is the number 1, 2, 3 thing that we really need to work on with staff when we have new staff.
Yeah. And that part about not overpromising, but just saying, hey, I don't know this right now, but I will get back to you. I think that adds a really important reliability, trustability
And
to
it's
that,
okay to
where
say,
people,
honestly, like we've had to really train people up, say, it is okay to say, I don't know. Do not make something up. Say you don't know. For some reason, people just have an issue saying, I don't know. Or, maybe they think that we don't think they're doing their job or they're not educated. I'm not sure, but just say, I don't know and get back to them. Patients really appreciate that way more.
yeah, it is definitely, it feels like failure on your end when you have to say, I don't know. But it's failure, perhaps if you leave it there and you don't try. But if you say, I don't know, but I'm going to go ask 5 other people
Right, exactly.
and try to track down that answer, that actually makes it even more trustworthy in the client's eyes than being able to give half an answer
Right.
as you are.
You're going
So
above
that's
and
awesome.
beyond then, right? They know you're going above and beyond. Hey, this person is not
Mhm.
trained on this. They don't know, but they're going to find out and you get back to them and they really appreciate you.
Do you do anything to kind of make sure that there are kind of cultural training, like understanding? One of the things that I encounter when I deal with overseas um, client relationships is just some cultural clash. Do you incorporate any kind of training and understanding kind of how American or Texan people interact and understand how that works? What are faux pas versus what's accepted, that sort of thing?
I think in terms of the cultural part, they do a good job. And yeah, we do have internal training on that. The more involved part is learning and understanding US based health insurance. It is the
Hmm.
most unique thing in the world, or no other country does it like we do. Even I, until right a few years ago, didn't really understand the difference between HMOs and PPOs. And there's Medicare Part A, Medicare Part B, Medicare Part D. I mean, right? Even like if you have your Blue Cross Blue Shield plan, there's 100 different health plans underneath that. There's Blue Cross something else. So
Mm.
that is honestly the hardest part, right? Learning how the healthcare insurance world works. It's patients don't even understand. Like they don't necessarily know the difference between copay and co-insurance and deductible. Those are not terms that we use day to day. Patients will like, oh, this is supposed to be covered. It is covered, but you have a $5,000 deductible. So the first $5,000 out of pocket, you have to pay for out of pocket. So they don't understand their own insurance. So us having to educate them and educate offshore staff, there is a learning curve there, 100%.
I can definitely see where that puts you in a really difficult position because you didn't sign up for that insurance plan. The client did. You didn't set the rules. The insurance plan did. But here you are having to be the one to break the bad news to the client that you signed up for something that makes you have to pay this much. I
Yeah.
can
And
definitely see
also
that
what
being difficult.
people don't realize is health insurance gives a lot of, so we call health insurance companies before every patient visit to one, make sure there's a referral or authorization, and two, to see what their out of pocket will be. And you could talk to two different representatives on the phone, they both give you completely different answers.
Mm.
Well, the health insurance companies, either purposefully or they just don't know their own internal information. And it's in their benefit if they, right, because they get to delay payment. That happens all the time. 99% of the time, just talking to patients out there, it's probably the health insurance's company's fault, not your physician office. Yeah, I mean, just, they give us incorrect information all the time, unfortunately.
So, as someone who is in that position quite a bit, do you have any kind of just brief tips on a client setting themselves up for success in not necessarily insurance endorsements, but just like what should they look into when they're signing up for an insurance, or what questions should they ask when they're trying to determine what plan to get?
One, if you have current doctors, make sure your doctors are in network because depending on which insurance you change, you might have to get a whole new set of doctors. So if you like your current doctors, that's a big part of it. Two, probably you need to understand if it's an HMO or PPO. HMO means you can only see a specialist if they have a referral from your primary care doctor. And the specialist office has to really work hard to get that. You might have to contact them multiple times to get the referral. Technically, it's supposed to be patient's responsibility, but in reality, it comes to the physician practice. So if you want to be able to see any doctor, any specialist at your own convenience, I would recommend going with a PPO. The caveat being it is more expensive. To have that choice, it is more expensive. And third, I'd probably say understand the deductible. So a deductible means how much you'll pay out of pocket until insurance kicks in. So for example, since we have a small business, health insurance is very expensive. So we have a very high deductible plan. I think it's $8,000 per person, and then it kicks in. So if you're going to go with a high deductible plan like that, the benefit is I get a health savings account. But if you're going to go with a high deductible plan, you need to know it. So things are covered, but it'll go towards that deductible, meaning you'll pay out of pocket until that amount. So if you don't want to do that, get a lower deductible, but it's always at the expense of costing more. And now it's true with some of these, if you're on the exchange plan marketplace, right, the subsidies went away. I have patients where those went up 40, 50% premiums. Obviously, it's hard to afford all that kind of stuff. So it's a system we have for now, at least. So it is not easy. But yeah, if you can educate some of these things. And, my parents, they're Medicare age. And so they're going between Medicare and Medicare Advantage, pros and cons. And so me and my parents even had a whole discussion. What do we think is best for them in terms of cost and the benefits they'll get? So definitely not an easy process. So I empathize with everyone, which is most of us that have to go through this.
We'll get back to that conversation in just a minute, but we have some exciting news to share. If you or someone you love has ever struggled to find the right provider for a complex illness, or if you're a provider that is tired of spending thousands of dollars getting new clients in the door just to find out they're not a good fit for your practice, then this one's for you. 194 million adults and 22 million children suffer from complex illness in the United States, causing over 80% of all American deaths. This isn't the fault of the patients or the providers, but the disintegrated system in which they live and work. Our research found that patients have to try up to 17 different providers and spend up to $50,000, with fewer than 20% of those actually getting cured. On the other side, most providers have to spend around $800 to get each new client in the door, and then have to waste precious hours screening, intaking, and diagnosing that client, just to find out the client is not a good fit for their practice. Now everyone has to start all over again, driving up costs and driving down success. Venice Companies is getting ready to change this. We're launching The Care We Need, a new platform designed to streamline that process for clients and providers alike. The client will be able to enter their symptoms once in one place from the comfort of their own home. The platform will then assess their information and match them up with a number of relevant providers in their area and at their price point. The providers will then receive a warm handoff with pre-screened clients committed to their programs, intake data already collected and ready in hand. This may sound like a lot, but I promise you it's only the beginning of what this platform will offer. Go to benniscompanies.com to sign up for our newsletter, be the first to know about user testing opportunities, or donate to support this cause. As always, like, subscribe, and send this episode to someone who would benefit from it. All right, back to it. So do you think your work in helping doctors reduce costs through hiring and automation, do you think that will affect how much the client ends up paying in the future?
No, because that's all determined by insurance contracts. It does not. But there is a whole new, I mean, it's not new, but it's been around. There's something called direct primary care. So direct primary care is not through health insurance. It's basically a monthly subscription type service. So a patient, in their 40s or 50s might pay $150 a month. They get to see their primary care doctor as many times as they need in a month for that $150. So if these sorts of things can reduce costs for those physicians, yeah, that would 100% be able to save costs for patients. Employers are now going to people for direct primary care as well, because it saves them costs. So I think it's a great service. You get unlimited time with your physician for $150 a month. Small things like blood work, or if you need EKG, is a extra expense, but at least you can get the attention, and it does save lots on cost.
So there's also a type of plan. I'm trying to remember the name. I'm looking it up really quick, trying to find that. But when a couple of years ago, and my family, we were RV lifing. We lived in our RV and moved around. And one of the things that we found was that there was some insurance options that you could subscribe to, and essentially it would kind of follow you from state to state. I'm trying to find what the name of that was because it was years ago, but it sounds like it might be, there are some options being developed to help people navigate a little bit better and not kind of break out of some of the structure that
Yeah, there are
is limiting where they are.
alternative coverage plans. They're not technically called insurance, but there's one called Crowd Health. It's kind of a health sharing platform. So the cost is significantly less. But again, they make sure very well, very explicitly it's not health insurance. Like they will not cover pre-existing conditions for a couple years, and it is capped. But if you're a relatively healthy individual and don't anticipate and just really need catastrophic type coverage, that might be something to consider, and put that with direct primary care if you want to kind of opt out or, can't afford the traditional insurance system.
Yeah, I feel like that allows for a lot more of a spectrum of health, because there's some people who are essentially, I've known some people who describe themselves as professional patients, where it's like they have chronic illnesses and they have stuff and they're just constantly needing the insurance. But then there's others who are like, I've been to a doctor once in my life, and there should be different plans that they should be on. And I know there's some customization already, but I assume there is. But something like the I forget the name of it that you just said, the primary care
Direct
one,
primary.
direct primary care. That seems like it would be a good kind of middle ground. And then the health sharing one would be great for if someone is otherwise relatively healthy, but they just need insurance technically for if they get in a car accident or if something happens, then they need to be taken care of. But then you're able to distribute that benefit around for when people need it, because not everyone needs it at the same time. I think that's a really innovative solution. And I'm glad to hear that there are different solutions being brought in to it.
Yeah, no, I think there's Crowd Health, and think I'm actually considering putting my family on it as well. So seems like a great potential option for people to look into.
So let me look at that real quick. So if someone suspects that they are in need or that they need to start making some changes, I'd like to kind of talk about two different people right now. One of them is kind of more immediate. they've had some life events that are making them more aware of their own personal health needs. And then there are others that it's more of it's a longer journey where they just want to make some changes. I want to kind of address these two people. What would be your kind of first three steps for that first population of, hey, something's not right. I don't know what should my next three steps be to start addressing this problem?
I mean, if they have symptoms that they're worried about, I mean, yeah, I'd probably go see their primary care doctor. If it's just that they want to improve their health and lifestyle, I think it really starts with food and activity. Let food be thy medicine is a quote that my wife really loves. Getting away from these ultra processed foods, more whole foods, plants. And again, just from the activity standpoint, just as simple as walking can be a good start. Just again, depends where you're at. So if you have symptoms that you're concerned about, yeah, definitely go see your physician. I've had people come in, fatigue, and they have awful something called that's obstructive sleep apnea. So basically, when they sleep, they're not getting oxygen to their heart and brain, and they might think they're sleeping okay, but they're getting awful sleep. And when you're not getting good sleep, you can't really do any of the rest of the stuff I'm talking about. So trying to take care of the whole body, right? Sleep, and then what, are you putting any other extra chemicals in your body? Smoking, alcohol, we talked about before. So that's how I would kind of address it.
I know for myself, some that I've experienced is ever since I was a kid, when I would sleep, I would be such a light sleeper that I would wake up 10 times a night just to roll over. In order to just roll over, like a lot of people would do in their sleep, I'm fully conscious and fully aware that I'm rolling over and everything that might be happening or not happening in the room I'm aware of. And then hopefully I go right back to sleep. But it wasn't until adulthood that I realized that that might not be normal.
Right. And sleep plays such a big role that we did actually start a sleep medicine practice as well. There's so many people that have, for example, obstructive sleep apnea that we can really get them treated. I'm very passionate about that. And how lifestyle, again, going back to lifestyle changes, how that can help people improve sleep. There's good science that turning off your phones, not having screen time, getting good exercise, having a nighttime routine, bedtime routine is just as effective as sleep aids, sleep medicine. Right. The only problem is it takes time and effort and you got to change behavior. Whereas you can get this one little pill that might help. But ideally, if you can do it, the lifestyle way, it's going to help all parts of your life. So yeah, I'm really passionate about sleep because it's a catch 20. You don't have the energy, like for example, sleep apnea, a big part of it is weight, but you don't have the energy to get that weight off if you don't get your sleep apnea treated. But to get your sleep apnea treated, you got to get that weight off as part. So we try to get them treated with, whatever way we can. And then hopefully we can help them get some of that weight off and then they can get off that treatment that we put them on, their CPAP or oral appliance therapy.
So one of the big things that I've noticed and I've been learning in the last several months is about discipline and understanding what exactly that looks like. Because what you're talking about, essentially, it's really hard to learn new habits. It's really hard to discipline your life in a new direction. But there's a quote that I heard a few months ago that's kind of revolutionized, this is an accurate term. It has revolutionized how I'm approaching my life. And it's the idea that if discipline is hard, you're doing it wrong. And that blew my mind because I've obviously been doing discipline wrong my whole life then, because it's always been really hard. But the idea is that if you're trying to do things based off of willpower, it will inevitably fail. And trying to just get up enough gumption to, I'm going to make it work this time, it will inevitably fail for 90% of people. But if you can instead set up systems in your life, set up infrastructure in your life that makes the right choice the easier choice, or at least easy to make, then you're essentially disciplining your future. You're rearranging your life so that your future looks different because you've rearranged the architecture, the infrastructure of your life. I'm urban planning background,
There's
so I was
actually
thinking
good
about
science.
infrastructure.
There's good science
Yeah.
behind it. So willpower is finite, but even if you take in like food, there's a great book about this. I can't remember the name off the top of my head, but they had multiple studies. One example was if you have your desk, I have my desk right here, and you have a thing of M&Ms right here on your desk. Obviously, you're going to eat way more versus if you put it literally 5 feet away. The amount of effort it takes to get 5 feet in general is not a big effort, right? But the amount of M&Ms that were eaten were decreased by like half. If you just put it 5 feet away. right? So, like you said, develop systems and strategies. Getting your if you're going to the gym, getting your bag ready the night before or something like that. That improves the consistency rate way higher. So yeah, consistency is the most important thing. So if you can develop systems, and then eventually people really enjoy working out, right? Once you get past that initial stage of huffing and puffing and you're sore all over your body because you lifted some weights for the first time in 5 years, 2 months from now, you're going to feel good. Like I work out honestly hour and a half every day. And it's one of the things I look forward to like every day. I want to go do my workouts, but I've been consistent for 3, 4 years now. And so it's not even willpower. I want to, but I think if you can get past that initial stage of the pain part of it, you'll do better. But yeah, I 100% agree with you. I love that saying.
One of the things that I learned that I changed about my life, and it has had a positive effect on my health, is that I changed up how my TV room was set up. My TV room in ours, it's downstairs. We had the TV set up, and then we had the couch set up and the coffee table, and literally the whole space was optimized to sit, eat, and watch. The whole space was set up for that. You couldn't really do anything else in that space. And that's what you're going to do if you decide to go watch TV, or if you go into that room, you just kind of the gravitational pull, you're doing this. If you sit down and watch TV, it's like, oh, let me grab a snack. Whatever. But what I did, I had a weight room, like just in-home gym in my garage, which was also in a bad place because it's out away from everyone. It's cold out there in the winter. There's nothing in there for entertainment or anything to enjoy. You just go out there, you do your weights, you come back. And what I did was I combined those two rooms. I reoriented to where the couch is off to the side. You can still sit on it, but it's not the closest to the TV. The weight room is oriented on the TV, and the couch is kind of off to the side, to where if you're tired and you need to sit down, fine, but it's an easy choice right there. Not just for me, but my entire family has had workout TV sessions. I have a 5-year-old who's sitting there like jumping around on stepping stones. My wife is walking on the treadmill. I'm on the weight bench, and we're all watching our favorite TV show right there. And it's like, just that infrastructural change, planning ahead, made all of these little decisions easier. That now I don't have to get everyone to go out and go for a walk, or everyone to go to the weight gym. It's like, yeah, we're going to go watch TV anyway, so let's just set up the weight room there.
Yeah, that's a
And
great
it's
idea.
changed so much.
I mean, we have a walking pad, which has definitely helped, right? Just get on a walk, or this desk is typically a standing desk, and I got a walking treadmill underneath there. So if I'm doing work, and it's just easy. You don't even think about it, right? Like I'm on the computer typing away or whatever, and you get 6, 7,000 steps. Yeah, I mean, if you can set up the systems, like you said, and make it easy, that's a great way to start.
And I like the idea of what you're doing, because not just in the everyday practice, like you said, standing desk and walking pad and all of that, but also in your work, you're essentially restructuring the infrastructure to be able to make these things easier. You're working with professionals, you're working with clients, you're doing everything you can preventatively, in a sense. You can say it preventatively, or you can say it preparationally, if that's the right word. I don't know if I just made up a word. But basically, to set up things ahead of time so that the end result is better. You're making a long-term investment in
Right.
how you're doing.
It compounds,
I
just like the stock market, right? It compounds, just like the stock market.
It does. And one of the things that I noticed, or that I've tried to keep in my mind about the structural change that I made to my TV room, is that it's not that I have to go work out. As soon as I think about I have to work out, it's like the joy turns off, and I'm not interested. But it's that it makes that choice easy. It makes that choice easier to do that. And so even if I don't work out every single time I go into that room, it's like my life trajectory has shifted a little bit because I made this change now. And so it might not look the same. Nothing might change dramatically right now, but 10 years from now, there's probably going to be a noticeable shift.
Or just changing the frame of I get to work out, right? One, I have the time, I have the finances, right? I'm not spending 100 hours working just to make ends meet, like many people in many countries. I have the bodily function to go work out. I get to work out. I get to use my body. So on those rare days that I don't want to, I mean, I kind of tell myself that.
So you started making those changes, and you mentioned earlier about just burnout being a huge focus for yourself. And then it sounded like you started wanting to share the innovations that you were doing for your own practice with other people, partly to help with the costs and monetization and all of that. But there's a certain systems mentality, systems awareness that happened with that. And I want to understand a little bit of what kind of made you more aware, made you tune into the systemic changes that needed to happen versus a lot of people, perhaps in my background and in the military or the kind of blue collar working background. It's like, well, if something's not working, just work harder. And eventually you'll work your way out of it. But you took a different approach in both your own practice and in how you're helping other people. What clued you into that? Is that something you're educated in? Is that a YouTube video you watched sometime? Or is that just like, let me look around and figure out what's not working here?
I think there's two things that initially got me thinking more. One, I have friends who have dads as physicians, and a couple of them don't really remember their dad until they're like 12 years old. I didn't want to be that dad. I don't want my daughter and son to say, "Hey, what did you do for the first decade of my life?" That was one. And two, I read a statistic that medical professionals don't live as long as the quote unquote regular population. And so working harder was not an option. I was already working as hard as I could. And so, yes, I had to educate myself. I think the first business book I ever read was something called The E-Myth Physician. He has a whole series of books, but it's called The Entrepreneurial Myth. So most of us that have professional jobs, doctors, lawyers, accountants, plumbers, if you start a business, you basically bought yourself a job, right? And so if you're not producing, you're not doing things, nothing else happens. So it's trying to shift that frame of mind to this entrepreneurial mind where you're not just working in the business, but you're working on the business. And so just that frame of, I love seeing patients. That's what I'm best at. And that's what why I went to medical school. I love that when I really make a difference in people's lives, but I also need to be able to step back and work on the business. And so just going down that path, and I read umpteen books about it and learning how to delegate and systemize. Until I read that E-Myth Physician, I've never heard of a standard operating procedure. We don't learn business in med school. We go there to be the best doctor we can, right? So this is all on the job training. And then once I spent enough time with it and did in my practice, obviously experimented a lot. Luckily, I'm more of an aim and then, I'm a shoot than aim type of guy rather than aim and shoot. So I just want to do it, get the action, and we'll learn from the feedback. I learned that other doctors are in the same spot I am, right? They're just burnt out and busy and they don't have a life. And as much as we like to educate and counsel patients on health, we're not healthy ourselves. So trying to give some of their life back by using like this staffing thing or, I've some other workflows that I help doctors with. It's been very fulfilling for me as well because I get to help people that are in my same spot where I used to be a few years ago.
You get to heal the healers in a way. One of the things that I love about the scalability that you're talking about is your focus in the beginning is helping people, helping professionals, helping doctors who are already doing good things, helping them essentially get their life back a little bit and helping them optimize their practice. And the way that I think of it is like right now they're helping other people, but like you mentioned, the death statistic is like they're actually kind of killing themselves while they're helping other people. So what you're helping them do initially is to survive and like reduce some of that load through optimization, through systems mindset, all of that, and get back up to where it's the same as typically the people around them. But then what you're doing isn't limited to that. When you start thinking in systems, when you start thinking in SOPs, when you start thinking in optimization and automation and all this stuff, automation, sorry, is that making up words left and right today? Is that it doesn't stop there. It doesn't stop at surviving because most people that I know who got in the medical field did so to have an impact. They wanted to help people and they're helping people as much as they can in a 24-hour period. But when they start thinking in systems, when they start thinking in automation, when they start thinking in some of the things that you're coaching them in and enabling them to do, they can start doing so much more. Because when you learn the basic skills to be able to automate enough to survive, those same skills help you take it further and scale your impact up amazingly when you yourself are able to systematize the right things, automate the right things. Then the people that you meet with, like you are able to meet with people at a higher level. The people that you meet with are better prepared for it. You're able to be much more efficient with your practice. Therefore, you're able to scale your practice should you desire it and be able to help more people. So it's not just I'm learning to survive, but you're really learning to thrive and take it like that's if you want to take your impact to the next level, these same systems will help you get there. And so I love that about what you're doing. It's not just here, it's actually here.
Thank you. Yes. No, we all are here to try to make some impact, right? That's why we try to become physicians and healers and things like that. So I'm totally agree with what you're saying.
So let's dream a little, you and me, when we think about the future of United States healthcare, and when we look at it in this systems mindset orientation, the physicians, the medical personnel taking on a little bit more of an entrepreneurial mindset and understanding things. How do I operate as a CEO rather than just as a doctor because I'm wearing two hats, especially as a practice owner? What do you think if this idea, not if, when, because it's inevitable in my mind, that this idea spreads to the rest of US healthcare, what do you think the client relationship could look like? What do you think health could look like? What do you think the doctor's interaction, engagement, coordination, like what does the future of US healthcare look like if everyone took on this mindset of the automation and optimization systems thinking like a CEO, not just a doctor as you're building that? What do you think the future looks like?
I think if you have these things in place, you open up your mind to have space to come up with innovation. And the physicians are the boots on the ground, right? Are the ones talking to the patients every day. But unfortunately, we're not really involved in the innovation, right? It's either legislatures or administrators, MBAs that are driving potential innovation. I think was it a couple of years ago, Amazon tried to get together with, some big companies to try to innovate the medical system and it didn't go anywhere. Again, you don't have the physicians that are boots on the ground that are involved in these processes. So if the physicians learn how to optimize and systemize and they can kind of talk at that level of the business side of things, they can really meld the patient part, the business part, the healthcare system part much, much better, in my opinion, than the other, the people in Washington that are trying to do it right now.
I love that. I actually have some relevant experience to that. I am totally not a doctor or anything, but even in how I have run my own house and being able to operate and all this stuff. And we deal with chronic illness in the house. So there's certain things that take a little bit more effort than normal. And we have a 5-year-old and homeschool and all that stuff. And what I was in the habit of doing is I was basically the primary worker in the house. And I don't just mean income earner. I mean, like if the dishes need done, I took it upon myself to get them done. If the garbage need taken out, if the things need cleaned or whatever, I was very bad at delegating. It actually started with an argument several months ago between my wife and I, where we were talking about stuff, and I was frustrated that I had so much on my plate, and yet things still weren't working where they should be, and she was frustrated things weren't working as they should be, and as a result of that, I kind of sat down with my higher power and like talked through this and like, how do I do this? And I came to the realization I needed to get better at delegating. And so I was like, okay, I kind of divided up the responsibilities in the house of not necessarily this is your job to do it, but it's you're in charge of the brain power that needs to get this done. I don't care if you're the one who does it, you just need to be the one who's in charge of getting it done. If you hire someone, if you ask me for help, whatever, I just don't want to be thinking about it because I have other things to think about. And it was amazing. Literally the week after I did that, it was like my mind it felt like so much more space to think about how to optimize. And it was literally that next week that I started having these ideas of maybe I should systematize this and change that. And I started looking up stuff on YouTube of how do I improve my systems? Using ChatGPT of like, how do I make like all these frustration points in the house, all these things that are difficult. One of the very simple example I want to share with everyone because it's so simple, but it actually really helps that it gave me the idea to do is using ChatGPT was the dishes. Like dishes are such a frustrating point, I think, for every household.
Right.
And it was a constant frustration for us because The sink would get full of dirty dishes, but because we had been working hard all day or dealing with chronic illness all day or whatever, like we hadn't had the chance to to unload the dishwasher. And so the dishwasher's full and the sink is full and we still need to cook and we still need those dishes. And it's just
Right, right.
all the time, like twice a week that would happen. And the idea was simply like put a tub beside the dishwasher, and that tub is where all dirty dishes go. Just a plastic tub, and it becomes essentially a second sink where you're able to you double the capacity of your sink, and you don't leave the dishes in the sink. You just put them in there. And that means that whenever you're ready to unload the dishwasher, you pull out the dishes, put the dishes from the tub into the dishwasher, press start, and move on. But that simple shift, I did not believe that it would change anything when ChatGPT suggested it. I had it explain it to me like 5 times. How exactly is this going to, it just moves the dishes. What is that going to do? It actually did amazing things. Like it took the pressure off of the sink. I was
Nice.
still able to use the sink. I was still able to cook. I was still able to, and we didn't have to do 20 different things in order to make that happen. It took the emotional pressure off it. But that's a very simple, maybe stupid example of when I delegated and when I started basically taking some stuff off my plate that I didn't need to be doing, need to be thinking about. It allowed me the space to think about how do I optimize my system. And little things like that, what I love about them is that they start to add up. The more you develop those little systems, the more you're able to scale, the more you're able to optimize your entire house, the more energy you have to do the next thing. And what you're talking about is doing the same thing in a practice. When you take the time to step back and think about the system, and every time you improve that system, you're able to operate at a higher level, which means you're able to improve the next system even better. And your entire system of systems works at a higher level. I love that you're coaching people on how to do that.
Yeah, what you just explained is taking off that little bit of mental burden, and it opens up your mind so much more, right? We underestimate how much those little mental burdens affect our home life, our wives' lives, our professional life, and then how much inertia, how many you have to overcome to just even make that little difference, right? That's what you thought was going to be a small thing, but it's made a huge difference in your life. So that small thing can make the biggest differences. So I'm 100% agree with you.
I was watching a YouTube shorts a little few days ago, and there was a quote from I forget what her name was, but she was talking about she was talking about relationships. The most toxic relationships are actually not the toxic ones; they're the ambivalent ones. In her words, they're the ones that they aren't bad enough for you to realize that you need to get rid of them. They're just kind of there sucking your energy. And you don't think about them because they're not bad enough, they don't hurt enough, but they're taking away from you improving your life. And it seems like this is a way of looking at it with your systems, with your practice, and with your house, and with all these little things that they aren't bad enough that you feel like they're bad, but they are bad enough that they're sucking your life away and you don't realize it.
Exactly. Yeah, those small little things keep adding up. Apathy is the worst, right?
Mm.
In a relationship is the worst. So, but yeah, these are all great ideas that you're bringing up.
So would you just mind taking a minute to explain where you go to find all the different stuff I'm doing? Here's how you get in contact with me in my practice, that sort of thing.
Sure, yeah. So people want to contact me in my practice. It's called Prime Heart and Vascular. We're in the Dallas area. Our website is primehv.com. If healthcare practices are interested in any of my other offerings, my offshore staffing service is Golean Health, GOLEAN health. I have a automation software platform. It's called Newton Health, Newton like Isaac Newton, NEWTON health.ai. And finally, I have a dietitian and personal training service where we offer these services to other physicians so they can offer to their patients. And that's called Pillar Health Solutions, PILLAR healthsolutions.com. That's about it.
All right, awesome. And are you on LinkedIn?
I am on LinkedIn. They can just look up Rishan Shah, RISHIN, last name SHAH.
Right, awesome. Well, Dr. Shah, thank you so much. This has been an amazing time. I love your perspective, not only what you're doing as a cardiologist, but also what you're doing as an entrepreneur and what you're doing to help healers improve their own life, healing healers essentially, and helping them optimize their life so that they are able to operate at a higher level. They are able to operate in a more healthy way. And as a result, their clients are able to get better quicker. Like they're able to improve their lives quicker because their doctors are operating at a more optimum level. I love the perspective that you bring to your business. I love the perspective that you bring to your practice. And I look forward to seeing what you do and the impact that you have in the future. Thank you so much for coming on.
Thank you so much, Brett. Appreciate it.
Thanks for joining us today. Be sure to check out our next episode here and use the comments to ask any questions or suggest any future topics. If this episode was helpful to you and you want to support our mission to improve U.S. healthcare and win the war on complex illness, you can donate any amount using the following QR code or the link in the description. As always, like, subscribe, and share this episode with someone who would benefit from it. See you next time.